Can everyone see that?
Yeah, so if you want to go to the agenda, please. So what we're going to do today is we're going to hear first from Northampton and then from Swift, and then David's just going to explain about the medals, and we thought it'd be then an opportunity to share good practice and innovative ideas across the Midlands. The slides have gone, David.
Oh, they gone?
Yeah.
That's because I messed with my laptop. Try again.
Thank you. Brilliant.
Yeah.
Thank you. So our aim is we finish no later than 1:45. We appreciate how valuable people's time are, but we just thought it'd be really good to share some innovative practice. Next slide, please. Just wanted to remind you of why we're doing this, because we're all on here because we're converted to Reconditioning the Nation, we're reconditioning ambassadors, but why are we doing this? We're trying to prevent avoidable harm in our patients. This is about improving outcomes for patients, but also for us staff and maintaining our well-being going into this winter, having some fun, but doing what's right for people. And it doesn't need to be, as you'll hear from our examples, huge changes. Small scale sustainable changes help our patients, and this is just designing your own initiatives and having some fun, and we're about to see some examples now. And as the leaders here today, it's all of our responsibility to encourage, motivate, be involved, influence and spread the good news of what's happening about reconditioning across our nation and especially across the Midlands. And I'll hand over to Marcella now, please.
Thank you. So hi, I'm Marcella. I'm the head of therapies at Northampton General Hospital, and I've been leading on the games at Northampton. So we have called our games the Deconditioning Games, and I guess just to give some context of that, we heard about the initiative that started in the east of England, which was called the Deconditioning Games. So learned from a bit of context for that. And what I'm going to be speaking to you about today is the journey that we have been on so far in our deconditioning games that we've launched internally. So I will just be talking through the background of where we started, where we've got to, and maybe just give you a few ideas about things you may well wish to do if you're implementing this in your trust. Next slide, please. So in the beginning, so as I said, we'd heard about this initiative from our colleagues in the east of England who had already done their games last year, and the reason we decided to do it before this had even become a national agenda, or rather a national launch of the games, was because we had found across the therapies teams and nursing teams that we were really struggling with deconditioning, with patients struggling to get out of bed, but partly about people taking accountability and understanding their roles and responsibilities about who should be doing that. And knowing that we're under significant workforce pressures, we decided that the approach would not be to just go down the line of this is what you should be doing, but actually why don't we look at a creative initiative to get people thinking for themselves about what their roles are and try and encourage an MDT working of doing that. So to begin with, it was recognising the problem, and the deconditioning games was the decision that we made as to the approach of how we were going to improve some of those things. So to begin with, because we did it internally, we formulated a planning group which comprised of nurses, therapists, and most importantly, I think actually at the beginning, was our communications team. So depending on where you are in your journey, you may find that actually just getting the word out to people was really, really tricky. So getting them on side and involved in the planning team was really important in the beginning. And we developed a really clear communications plan. So on the right hand side are some pictures of the documents that we developed. So the How to Get Involved booklet was already in existence, and we just amended it, which I'm sure you've all seen in varying versions of what the games is about, how people can get involved, and so on and so forth. But we also created a briefing, which was for all kind of stakeholders, if you like. So actually to set the expectation for managers across the organisation of what the games was, what we wanted from people, and how we sort of got that buy-in from people across the trust, really. That proved to be really, really helpful to set that expectation and help get it on the agenda for the organisation. So if you are struggling with that, I would definitely encourage looking at something such as a briefing. I think the other thing we talked about right at the beginning was setting realistic expectations about what was achievable. As I'm sure we're not alone in the sense of our staffing is really depleted across therapies and nursing. So right from the beginning, we had to be really clear about what we were hoping to achieve from this project, and that actually we weren't necessarily going to be looking at huge, large-scale changes that were likely to fall down the first time we had short staffing across the trust. It was literally going to be looking about behavioural changes that we could make to try and get this back on the agenda and in people's minds in just their daily practice, really, which of course we should be doing anyway. And then I just wanted to say at the bottom, you know, we learned from others, so East of England, but also Luton and Dunstable Hospital we spoke to specifically, who'd been very involved in the games, and obviously that's why you're hopefully here today, to learn from others to see how you can implement good practice in your area. Next slide, please. So I just wanted to show you what we did at the beginning of the games to help to launch it. Apologies, you might already be past this, but I just wanted to share. So what do these pictures mean? So top left, where it says deconditioning games and there's the characters, we have a weekly briefing which goes out trust wide, which we now have a standard section in, where we're promoting and educating what's been happening and helping people to show progress that's happening within the organisation, and there we're celebrating where people have been awarded medals. Bottom left, we've got just a snapshot there of doctors teaching. So although we know that a lot of this, the work is probably going to be done around nursing and therapy staff, actually we know the doctors have a big part to play with that in terms of being clear on their medical plans, being clear about when patients are going to be in hospital, and communication with patients. So we've now started doing some teaching specifically to the doctors around deconditioning and discharge whilst they're in the acute setting. In the middle, you might recognise some of these faces. This is Amelie Morgan and, oh my goodness, his name's completely just escaped my mind, which is dreadful, but hopefully you recognise him. Who is that? That's dreadful that I can't think of what his name is.
Colin Lewis.
Colin Lewis, thank you so much. I've said his name a lot. So we managed to get through Cameo I managed to get some funding to agree that we would use these Olympians to help spread the messaging, in the hope that it wasn't just about management guiding, but actually some true Olympians to spread the message about the games. And then on the right hand side, we did a really big launch where we actually helped to spread the word by taking the torch, like you would in the Olympics, a torch around the organisation, and we had at the bottom right our opening of the games, which again just helped to sort of springboard, I guess, the agenda and the message around the hospital. Next slide, please. Oh, perfect. This has moved around a little bit, so apologies. So just to share where we're at. So we've been doing these games for a few months now. So we're well on our way, and you can see some examples of some of the awards that we've given out. Because this was launched prior to the national games being launched, we have developed our own branding and our own certificates and so on and so forth. So we're still continuing with that, but we're also now going to be awarding people the national certificate alongside that. So they'll have recognition both internally and externally. We've given out 13 bronze medals so far. We know there is loads more work happening than that, but one of the challenges we've found is about getting people to come forward and tell us what they're up to. And I think because everyone's so busy, filling in those application forms has been a bit of a challenge. So we're working through how we can support people to make that as easy as possible. So we're recognising the work that they're doing. So just on the right hand side, it's just to share really. So what are we doing? The games are underway. We plan to run ours until the 25th of January, but we've actually decided that we're going to extend it. I think the point of these games, it's not just about the games, is it, and about we do this, we've ticked the box and we move on. This is hopefully the beginning of trying to make a cultural change within our organisation. So we have actually decided to extend the games because people are doing so well, to keep that momentum going and keep it as a trust agenda. One of the biggest things we're focusing on at the moment is, like I've said, encouraging people to come forward and share the good work that we're doing, and we're working with our comms team to look at doing videos and sharing photos so people are seeing the good work that's happening, and hopefully that will encourage them to participate as well. But one of the other things we're really trying to promote is the staff element. So I think we all know if our staff are happy and they feel recognised and they feel looked after, that can have a direct impact on how the care that we're giving to our patients. So we're really trying to have a drive on the staff award as well. And the other thing to share is that we did decide that we would buy physical trophies for our staff so that they could display them on the wards as well. So just a bit of a suggestion for people. We've definitely found that visual things that people can show their and be recognised and be able to celebrate that if people come onto the ward was responded to really well. So you can see a little picture at the bottom. We got these trophies which cost, I think, about £8 each, which obviously don't go to everyone but to a ward. So that might be an idea depending on how your trusts feel in terms of whether visual prompts can be beneficial. Next slide, please. So I've just put this slide in to say there is no magic wand. This is really difficult. We shouldn't need to do a deconditioning games. This is all of our jobs. But fundamentally we are, because we're under so much pressure. And I think that's why potentially in certain places we've drifted from perhaps some of just our core roles and responsibilities because of time. So I just wanted to log on here. Just because I've been asked to come and speak today doesn't mean that means we've got it cracked. We absolutely haven't. This is hard work. It's required a lot of persistence from my perspective to get people on board and keep this on the top of the agenda. People conceptually are on board with it, but it really, really does need at every opportunity bringing it up to keep it on people's minds and really keeping it in that central kind of mindset of this is governance. This is about patient safety. This isn't just about a fun engagement that we're doing with our national colleagues. And also just clear messaging is the key bit that sort of comes along with that. So if we just move to the last slide, which is just, I'm not going to read through this, but I'm guessing these slides will be shared. As we're already part of our way through the games, depending on where you're at, I just thought it might be quite nice to share some top tips. I think I've probably been mentioned quite a few of them already, but there are themes, particularly the things that I've highlighted are just things that I would suggest are really important and would help with the success of your project. And the one thing I haven't mentioned, which I'll just pick out, was about engaging our speciality teams. So I've had really good positive feedback from our speciality nurses and therapists that are involved in things like our dementia team, falls team, learning disabilities. All of those teams have got really good expertise that dip in towards and are quite good people to be able to help you with your messaging, but also to help to find solutions. So if you haven't already, I'd really suggest that they would be good teams to link with. And equally for the staff initiatives, the HR and wellbeing teams that you might have within your services, I found to be really, really helpful in terms of being able to signpost staff, but also in terms of sharing resources. That was very much a whistle stop. But if anyone's got any questions, I don't know if we'll do those now or whether we'll do them after the next presentation. Yeah, perfect.
Thank you so much. That was really interesting. So much going on to make a difference. That's brilliant. We'll introduce Cam next from South Warwickshire, and then we'll do questions at the end and sort of comments. The recording from today and the slides from today will be shared on the Futures platform. Over to you, Cam.
Hi, so my name's Cam. I'm the Assistant Service Manager for the Frailty and Care of Elderly at Swift. This has given us a real opportunity to showcase all the brilliant work everybody's been doing. So like Marcella said, it is very difficult. I wholeheartedly agree with her, but it's nice to also see and recognise all the brilliant work that everybody's doing in the tough times that we've all been through and we're sort of still going through. So next slide, please. So we've just put the medals on there, and I can tell you so far in Swift, we've had 18 applications that we've put through. So we've had 7 gold, 10 silver and 1 bronze. And there's many more that we've still got to apply for. What we've done is at Swift is made sure that we've had a champion that's come forward from every area, every ward area, who want to take part and are actually showing us what they can do. So the responsibility is for everybody to be involved, but the champion is actually taking the lead on there, and then I'm engaging with the champions to see what they can do. We're all learning from one another to see what's done in one area, can we do it in the other area? So it's still very much early days for us, and we are learning this. Next slide, please. So we've been doing this for over the years. We've put down 2018 because we were sort of thinking, how far back can we go? Because in Swift, we've always carried on with activities. So we did a lot over the Jubilee week. We get the patients involved. We've got the staff involved. If we have a patient's birthday, we celebrate the birthday. We mark the occasion. We've been very much doing the football now, and also did the football in when we had the Euros on. We had WASPs come into Swift. This was actually during Valentine's Day and Christmas as well. And they took part in playing with activities with the patients. This was like before COVID, but it gave the patients a good opportunity to actually have conversations. And it was really interesting because some of them actually recognised the players. So they were able to engage in conversation with them. Onto the left of the screen, there's a picture there with the window. So that was during COVID times, which was very difficult. So we had reindeers and people dressed up in Santa and singing to our patients as well. And onto the right on the top of the screen, you can see we had someone bring in some lambs. So the patients were really excited to be involved and see the lambs as well. So we are always trying to put in as many activities for the staff and for the patient as well. Next slide, please. So what we did was we launched a couple of PDSAs. The Good Morning Wave was actually one that I thought of. So what we wanted to do was find a way of engaging with our patients in the morning. So once they've got up and they're dressed, and this is all part of NPJ paralysis, we thought it's good to put some music on and do a bit of an activity where the patients would wave to one another. And what we did was we rotated, they'd rotate their hands to wave, move their legs. This was all risk assessed, and it was actually set up by an OT who had actually structured an exercise program, making sure it's safe for each patient while they were doing this. Next slide, please. So NPJ paralysis, which I mentioned, we had our chief executive, Glenn Burley, was involved in that. So this is something that's been going on for years. With this, we're still continuing it on now currently. We're making sure that our patients are up, are dressed and are involved in activities. Obviously, due to a patient's health, this is not always possible with every single patient, but we're trying to engage in activities, even if a patient is not able to actually sit up, trying to engage in activities with them as much as we can, because engaging in activity isn't necessarily just for them to get up and to move around. If they're unable to do so, we can actually sit there and use a simple way of just doing a word search, a bit of colouring, having a bit of conversation. But if patients are able to get up and move around, then we do more activities with them. Next slide, please. So this is carrying on with the NPJ paralysis. We all know that patients are better being in their own homes. So if we are doing these activities, we're actually helping with reconditioning. And we know that patients are more likely to, if they've got longer length of stay in bed, they're more likely to have further illness and increase their length of stay. Next slide, please. So NPJ paralysis, this was quite recently that we did. So we wanted to raise awareness. All the staff were dressed up in their PJs. We actually had one of our nurses that actually baked that NPJ paralysis cake. So we have realised that we do need to continue to educate staff the importance of getting patients up and sitting out. Ensure we have a good skill mix of staff. plan a time that this has to be actioned every time. And we have actually made some leaflets where we're giving them out to relatives and loved ones, asking them if they can bring clothes and slippers for all patients. And we have end PJ paralysis champions, so they're the same people that are champions for the activity games as well as the end PJ paralysis. Next slide, please. So this was a Frailty Good Morning Wave. This was the structure that was put together by one of the OTs. So every morning, 8 o'clock, after having breakfast, this was the structure that we would follow. So we'd have some music playing, we'd have a physio assistant, and we'd have an OT. They would lead on the activities. Our nurses would join in, our CSWs would join in, and it was really, really nice to actually get the patients to move. They could move their shoulders, they could move their wrist, wriggle their fingers, and you can see on the pictures as well how much they can actually do. And I think sometimes this is what we forget, that when patients are lying in bed, we need to be able to encourage this a lot more. So we did do this as a PDSA. It worked really well. So we are still carrying on with this. Next slide, please. So for us to know that this worked well, what we did was we used this as an audit tool for measuring. So sometimes when you ask, because we're dealing with dementia patients and sometimes they can be confused, it was trying to find an easy way of measuring how a patient would feel before the morning activity and after the Good Morning Wave. So it was like whether they felt good or they felt neither good or bad or don't feel good. And to the right of that, you can actually see their feedback before the activity and after the activity. There was a huge difference because a lot of them said, you know, the music just makes them feel so much better. It reminded them of times when they've listened to music, they've heard music, they've done stuff with their family. So this was all very, very positive. Next slide, please. So we started off doing the Winter Olympics. I donated some games to the wards. Some of the staff also donated some games to the wards. So what we did was we had our patients up, and we've also had some of our patients up and dressed, and then we would play and activities. So you've got the darts there, and then you've got the pick a duck. We also had Kids Knit Better, and so that photograph with the quoits, it's actually a student that's playing the activity with the patient. But this made a huge difference because it was actually us engaging in conversation with them and making them feel a lot better. And that also helps with their length of stay, that they just feel involved, and it's making the patients feel important and valued. Next slide, please. So what we also had was we had a lady, her name was Barbara, she's from Prior's Petals, and she worked very well with the patients. She came on to frailty and the care of elderly wards, and she did flower arrangements with them. So when we did the flower arrangements, it gave them a sense of stimulations through the smell, through the touch. We got chatting to them, and it was so interesting because even when I was going around with her and I was speaking to her, we had a landscaper in there. We had someone that actually was telling Barbara where the flowers were from, and we were so shocked because if we hadn't done that, we wouldn't have learned so much about the patient. So it's really important to do an activity like this and engage in conversation, which helps with their memory and their names of flowers, their colour choices. There was just so much of a conversation that we had. So to the left of that, one patient actually gave us feedback, and their family was there at the time, and that was all very positive. Next slide, please. So data from the results that we did, we found that during the time that we did the PDSA, we did have a reduction in falls, and patients were discharged a lot earlier in the day. Next slide, please. And we also noticed that on this particular ward where we did the PDSA, our length of stay had reduced, so that had started to dip. So it just goes to show that actually helping patients with an activity does benefit their healthcare. Next slide, please. So this is another activity that we're also doing. So we have Emma, who's one of our frailty discharge nurses, when patients are discharged from Swiss frailty wards to their own homes, and if they've got a Warwickshire GP, they will receive a phone call from one of our nurses, and then they have an option to have a conversation with the nurse and also an option to have a visit. So this is normally done 72 hours after a patient has been discharged, and the reason we do this is to reduce readmission. So as part of that, what Emma also does is she encourages them to get up and go exercises. So you could have a patient that's bedbound, but she helps them to roll from side to side. They're able to do leg raises, hand circles. But if a patient has a convenient circular route in their home, she asks them to do a bit of a walk and they can do laps round. They can also use support of their dining chairs, and they're able to do marches and lift their legs up. So there's a lot of ways of doing exercises and encouraging patients to continue. Next slide, please. So this is another thing that we did. We did Remembrance Day, and we had packs for the patients and everybody got involved. It was really good. It's just so nice to get all areas involved. So we have quite a few wards, and we have Kissing It Better, who's one of our charities, and they support with this. Next slide, please. So Kissing It Better, this is our team of Kissing It Better. They have, normally they're sixth form students or they're year 10s and 11s. They come over to us and they play games and they do activities with the patients. So this is something that I've been actually spreading across and getting them to cover quite a few areas. We also have our therapy dog, Luna, who also comes and visits as well. And you've got a violinist, Peter, he comes along with Kissing It Better as well. So sometimes he comes in and a patient might request a song and then he'll be able to play the music for that as well. But the children love it, and when it's elderly patients, they absolutely love engaging with the children. So there's a lot to do, and it's simple games. So we've got snakes and ladders there, we've got word searches, we've got colouring. It's just having conversations with them makes a lot of difference. Going on from this, one of the things that we are now in the process of doing, when we had the lady come in from the horticulture doing their flowers, because that went down really well, we are now in the process of developing a sensory garden for our dementia and care of elderly patients. So we're raising funds for this currently and designing this. So this will give us an opportunity for our patients to come out and do some bedding. We're raising some high beds for them to do a bit of flowering, bedding, and also an area for them to sit and engage with other patients, because when patients are on the ward, the closest they see is a patient in front of them or the patient next to them. So it will give them an opportunity to come out into an area space where other care of elderly patients will also be able to join them. And next slide, please. I think that's it, isn't it?
That is your last one.
Yeah, that's it.
Thank you so much. That just shows how much you're doing and the variety of different things. Appreciate that you started some of this before Reconditioning the Nation, but you were the first gold medal winners in the country for the changes you've made over the last couple of months. You should be really proud of that. I'll hand you over to David now.
Thank you.
Hi everyone. It's just a reminder that you can get medals for all these activities, as has been alluded today. And it's just a quick reminder of that. It's not just for patient initiatives, it's also for staff. Obviously, there's 3 levels. So there's 3 categories: making a difference, supporting people to keep moving, and supporting staff to keep active and well, and that's important. But there's also 3 levels of medals, and it's not a ladder. You can go straight in at gold, or if you're just sort of putting your toes in the water, maybe bronze is more appropriate. However, we're a competitive lot, and with the Midlands being the biggest region, we aren't number 1, and I think we should be. So this is just showing you what the medals is at the minute, and we're just behind the east of England. So I think we've got some scope to grow there. So if you want to upload what you've been doing, you can do it via the Futures page, and it's all done nationally. So we get the information every sort of week. So that's it from me.
Thank you, David. Has anybody got any questions for our speakers today, or any comments generally about the Reconditioning Games and what you're doing in your organisations? Do people think it's making a difference for your patients? Seeing Cam's data there, it appears to be. She's only a month's worth of data there showing an improvement, but that's brilliant. It'll be nice to see it in a couple of months' time. If there's no comments from anybody, what I would say is all the information is available on the futures page. Please go on there, look, take the pledge, get involved and make a difference for your patients. We'll be doing another one of these events on the 6th of January. And if you'd like to speak or you'd like your organisation to showcase things, please let either myself or David know. Our contact details we'll put into the chat. Funding for resources, Leanne, there isn't any national funding available, but so it's local funding within your local systems. What I would say is most of these initiatives aren't actually costing lots of money. They're things that people have already got and they're using them, but there's no actual funding available as such, unfortunately. And I've just put my email address in the chat, so if anybody wants any help or support with anything or any guidance, David will put his in as well. We're here to support you, and just let's have some fun and let's bring some joy into this winter for our patients. And can I just thank our speakers, so Cam and Marcella, and all of you for just who've attended, just for supporting Recondition the Nation and making a difference for our patients across the Midlands. So thank you all very much, and I wish you a good rest of your day.